David?
Yeah.
All right. My name is Dr. Beachy. I'm one of the behavioral health consultants that Dr. Stedman said would be in.
Right.
Yes. So she explained to me and gave me the rundown that you are a brand new patient here. And
First time.
Awesome. Well, welcome. And then she said that you moving up from Oregon. Yep.
Yeah.
All right. Awesome. And that she had said that you were looking for maybe a counselor of some sort.
Yeah, I had a counselor for a while down in Oregon, and the first thing moving here, I was like, find a PCP. So I'm glad I got Dr. Stedman. She was great. And the next thing was going to be just finding a counselor, and I had no idea that even coming here that there was going to be people here.
Right.
Yeah.
Well, why don't I tell you a little bit about our service, and then you kind of decide how we want to do this.
Okay.
So I'm a licensed psychologist by trade.
Okay.
But I work as part of the medical team. And so my title is a behavioral health consultant, which is just a fancy way of saying part of the medical team. Oh. And so you have your PCP, you got your BHC, your nurses, and your MAs.
I like that.
Yeah, all part of your...
That was a big problem, like back where I was in Oregon. Like they wanted to talk and they could never get together and
you had to always sign all those forms.
Well,
and
even
whatnot.
when I signed them, like they still like have a chance of like communicating.
Yeah, so that's one of the huge benefits is that kind of all of your mental, medical, your whole healthcare is like all here.
Oh, okay.
Now, before you get too excited, just want to be transparent that our visits tend to be more like 25, 30-minute visits versus a traditional 45 or 50.
Yeah, that's usually what mine were. Yeah.
Yeah, that's how it most commonly is in like outpatient mental health settings, but in primary care, they tend to just be a little bit more focused, 25, 30-minute visits.
Okay.
And then the other thing is how often you meet. So based on what you said,
we would meet like weekly.
Yeah, super common. So in our case, we might do a little bit more playing it by ear.
Okay.
So I'm here all the time. And so some folks come in and then they might meet up in like 2 or 3 weeks, come up with a game plan, meet up another 2 to 3 weeks and kind of play it by ear. And when they're needing extra support, we might meet a little bit more regularly. Oh. But then as things kind of calm down or they got a good plan, then we might meet a little bit less.
So it's like based on what's going on.
Yeah, exactly. Almost think of it like your medical doc.
I was literally just thinking that. I was going to say, it's like almost like my primary care doc as things come. Okay.
Same idea. So when you need some support, we're here. And then if you kind of feel like, okay, right, I'm in a good way, then you go, and then this is your only intake. So there's no other intake.
So that was literally going to be my next question, because the thing that happened with some other counselors before, like if I didn't see them for like a month or two, I basically got like, I don't know what the word was, like discharged or something. And then I had to start the whole process over again. So I have to do that again here if I don't
No.
Oh.
So what we could do today, if you're down for it, is what I can do is ask some questions to get to know you. It won't take us long, probably like 15 minutes. And then that's your intake. So once you're in our system, you can see me or any of our other BHCs, and there's no other additional paperwork. There's no other process.
So I mean, but what if I don't know, what if things are going well and I don't know, 3 months goes by and I need to see you again?
That's no problem.
Over. Really?
Yeah. So you'll have my card, and of course you have the number. To the clinic when you made your appointment here, you would just ask to say, hey, can I meet with Dr. Beachy or, any of the other BHCs, and they would get you in.
Let me ask you this, because one of the other things I ran into sometimes is like, even though we would meet like weekly, like sometimes like things came up, like even between the weeks that I really needed to talk to someone. I mean, how does your clinic work with that?
Yeah, we do kind of on-demand visits for, when life happens, because it does. And so in that case, you would just call, or heck, even walk in and say you need to talk to a BHC. So there's myself, and we got a whole crew. There's a bunch of BHCs. Like normally we try to have about 4 on at a time. Yeah. So we try to make it as convenient as possible that you come in, you get what you need. Now here's the thing though. If you and I are working together and you feel like, okay, this isn't enough, or you wanted more support, we absolutely can get a referral. Would you be okay with us just going ahead and getting started with the, it's not really an intake, but the questions that we asked everybody,
absolutely.
Give it a shot.
I appreciate you explaining this, because when Dr. Stedman was talking to me a little bit about it, I was like, yeah, I'll probably just go to this actually, I wouldn't mind giving this a shot.
What we've had people do traditionally, like other folks in a similar position as you, is just give it a try. Okay. So we meet for, we can make this up 3-4 times. And if you feel like, okay, this is enough, this is what I need, I'm on a good roll, then we just do that. If after a few visits, you're like, oh no, like we were saying, definitely need more support and I want it to be more consistent, what we'll do is we'll put in a referral to the community mental health agency. Also, we can look at your insurance because we have some folks that do private.
I was just about to do that too myself, like to see if there's any places in the area.
Yeah, and so we can look at that list and see what works for your insurance.
Well, I don't know, I wouldn't mind trying this just to see how it goes and go from there.
I've had so many patients that prefer to do more of that like 25, 30-minute visits and kind of on the as needed basis, playing it by ear, because then you can kind of call the shots and then you don't have to really enroll in anything. So it's not like, okay, we got to do 12 sessions of this.
Okay.
You're here and then you call the shots on what's helpful and what's not.
Okay, I think this is great, yeah.
All right, sweet. Okay, are we okay to move ahead?
Let's do it.
All right, question number 1.